once you demonstrate that improvement, it's not really absolutely necessary to keep doing exercise with oxygen. You could just do regular exercise and accrue a great and maintain the benefit. However, maybe one should, if they're healthy, recheck the levels at 6-month intervals, or if they're not, 3-month intervals, to know when to do a sort of a touch-up program. And that's kind of where I'm going with that. Yes?
Are there certain places where the oxygen is better? Like, is it better to exercise outdoors or near the seashore or anything where there's a higher concentration of, you know, for like long-term?
Not that I don't think it's not, I mean, I think it'd be nicer to be in a place that wasn't polluted, but reality being what it is, we're sort of faced with dealing with our reality. And so, yeah, it'd be lovely to be by the seashore, but that's not going to happen for us. So anyhow, and when you're doing the oxygen step therapy, you need the concentrator. Yes?
I was wondering, would hydrogen peroxide taken internally be ever recommended or helpful?
Can I talk about that a little later?
Oh.
Yeah. So, in people for whom it may not be working well, or there may be a problem, there may be issues like, for instance, that their lung disease is very severe and they need that addressed. There are people for whom, if their lung disease is so severe, it may not be an effective therapy for them. That's one area, very advanced chronic obstructive pulmonary disease, that it isn't particularly effective. Or if their heart failure hasn't been adequately treated, or if they're anemic. So you're constantly going back and looking at what else might be germane or appropriate. Hormonal balance may be important in men with very low testosterone levels. If we can determine it's safe to use testosterone because there's no prostate cancer, testosterone helps improve circulation to the periphery. In some women, you can actually use DHEA as a proxy for testosterone, or even very low doses of testosterone, particularly if they're very weak, and amplify their benefit, if you would. The lady was talking about other vasodilators, so you can use L-arginine as an alternative, and may work as well as the dipyridamol, although again, the primary research was done with the dipyridamol, so that's why in people where I'm really trying to get the best effect, that's what I use. But L-arginine in a dose of 1,000 milligrams can be effective. Also, quercetin, while it doesn't have a direct vasodilating effect, has a very good effect on improving aerobic energy utilization and production. And so a dose of the activated quercetin, which is quercetin with bromelain, in a dose of 2 500 milligram capsules can be very effective prior to exercise. And finally, even though D-ribose can be very effective in people, let's say, who have heart failure or chronic fatigue syndrome, in improving their ability to exercise without the post-exercise exhaustion. So those vasodilators are effective. And you know, there's a range of pH, and again, when you're talking about pH, you're not talking about absolutes. But if a person is very acidotic, that person, based upon what we can measure, and we can actually do a true blood gas to see that, then again, the subtle alkalinization through diet has great value, again, in improving the delivery of oxygen to the peripheral tissue. And you were asking about hydrogen peroxide. You know, there's a lot said about the oral ingestion of hydrogen peroxide, and I know that there's a lot of anecdotal stories about its benefit to people, and I appreciate that. For many people, they perceive a great benefit, but I haven't seen true evidence of benefit in any kind of literature that's reasonably, I would say, scientifically oriented. There is, and using hydrogen peroxide is used, but it's not oxygenation therapy, it's oxidation therapy. And intravenous hydrogen peroxide can be used. It can be given in diluted. Often we do it in in glucose, because if you give it with sodium chloride, it can create a little bit of an acid, which you'd like to avoid. But in some people, for instance, with diabetes, we do it. But it does create a transient oxidative stress, and it does that not because it goes throughout your body and kills things or bugs or anything, but it promptly forms, it promptly oxidizes and forms lipid peroxides, lipoperoxides, which are a free radical molecule that's more sustainable and long-lasting than a water-soluble free radical. And that goes through the body and creates this transient stress that seems to improve mitochondrial energy production when done carefully. It seems also to help with immunologic function. As an example, there are people in my practice who have recurrent MRSA, the staph infection that's so difficult to get rid of. Fortunately, we've been seeing a little less of it in the community. I guess people are finally realizing that they have to be more careful. But one physician who is a very prominent physician was getting these terrible infections over and over, and we really had no simple help for him, and out of desperation I suggested he try this, and the infections stopped with that. I had another person who had a chronically open wound, and what we did with that person is we have a a sauna, you know, not a sauna, a steam bath cabinet, and we put a little bit of, we put oxygen with a very low amount of ozone mixed in it, and the wound healed where before it hadn't healed. So I think in these select areas it can be beneficial. But there is a person who's a great proponent of oxidation therapy, and his take on it is that it's exercise in a bottle. It does what exercise does. So getting back to the exercise, one thing that you can do, well, one thing we do is we establish the, let's say, the therapeutic heart rate range by doing the cardiopulmonary stress test. And you're on a bicycle pedaling, and we're measuring gas exchange because you have a mouthpiece in your mouth, and we're measuring the oxygen intake and the carbon dioxide output. When you first start exercising, you take in more oxygen and then you put out carbon dioxide. But you reach a point where you start to be putting out more carbon dioxide. That is called the anaerobic threshold. And what it means is that you're now depending on anaerobic metabolism to continue making enough energy to exercise. And it's from then on, you're increasing the amount of lactic acid that you make, which is a consequence of the non-mitochondrial way of making energy, which is an older and more primitive way of making energy. And you feel the burning in your legs, or whatever you're doing, you feel the burning, right? And so the point in people who are highly conditioned, the Lance Armstrongs of the world, they want to figure out how they can tolerate going into anaerobic metabolism for as long as possible. They want to raise their anaerobic threshold, but then they want to go on forever as hard as they can. But in those of us who are getting older and trying to just be healthy, unnecessary and excessive lactic acid production and the inherent increase in free radical formation isn't that valuable.